All right, dude. So, good evening, everyone, and welcome to another riveting episode of Know Your Pharmacist, the live stream where healthcare innovation meets insightful discussion. I'm your host, Dr. Joaquin Acosta, CEO of PharmTrue, here to guide you through an exploration of today's most pressing health topics. Tonight, we're diving into a significant challenge facing our healthcare system: the shortage of pediatric RSV shots, a situation that's more than just a news headline. It's a daily reality for countless families. We'll explore the intricacies of this issue, understanding its impact on our community's health and well-being. We're also tackling a critical aspect of patient care that often goes unnoticed: the complexities of Medicare Advantage plans. So as we navigate this labyrinth, we'll uncover the struggles and frustrations of those who rely on these plans for their health needs. In our Enlightenment Hour, prepare to be amazed by groundbreaking research in cancer treatment, where scientists are harnessing the power of vibrating molecules to target and destroy cancer cells. This represents a leap forward in our ongoing battle against this formidable disease. Our Herbal Wellness Corner offers a refreshing perspective on menopause management, highlighting how Canadian women are finding solace in cannabis for symptom relief. This segment promises to enlighten and empower, offering alternative approaches to wellness. And in our community spotlight, we have a special treat: an insight into the adrenaline-filled world of dirt track racing at Vado Speedway Park, featuring star racer, some say the greatest of all time, Kyle Larson, coming into town tomorrow, guys. It's an exhilarating journey that symbolizes the spirit of community, passionate, driven, and always striving for excellence. Finally, our Men's Health Minute focuses on a crucial aspect often overlooked: heart and vascular health. We'll delve into the proactive steps men can take to ensure a healthier, more vibrant life. So join us tonight as we weave together these diverse threads of healthcare, technology, and community, creating a tapestry of knowledge and empowerment. Remember, your health, your wealth, and knowledge is the key to unlocking its potential, guys. Let's embark on this journey together, learning, growing, and thriving as a community. Welcome to the Know Your Pharmacist live stream, guys. So RSV immunization, my baby girl got it yesterday. We're thankful that Little Steps Pediatrics had it in stock here in town, and they had been struggling to get a hold of that vaccine. It's been out since like last September, right? So again, RSV immunizations for infants and children 19 months and younger, guys, definitely a good one to get. Obviously, RSV time is kind of starting to peak and probably start to fall on the other, downward slope of virus as we start hitting into January, but definitely still important 100%, because little ones in RSV literally can just that's the one that you don't want. I've even seen that COVID in your pediatrics 19 months and less is probably more preferable than RSV, and those parents who have had RSV or are dealing with the RSV in their children, definitely those O2 sats will drop and the breathing gets difficult. And, obviously that situation gets compounded on top of, whatever hospital visit and, respiratory therapy needs to be induced. So basically the new RSV shot, guys, as we are showing you guys right here, Beyfortus, those from children 8 months and less. And then your Nervisimab is from 8 to 19 months. So those are your two different sections there, guys. I don't know who has it in town. I know Little Steps Pediatrics had it as of yesterday. It's going to be to that point where it'll be part of routine vaccinations as soon as it's available and things like that. But, we do want to see those shots getting out there to those who need it. Although also adults over the age of 60, that RSV vaccine that came out last May, definitely still one to, try to get if you haven't got it yet. That one's been a little bit more available, but I couldn't tell you the exact, availability in town right now. All right, let's jump over to Tech Talk, guys. I'm going to show you guys a little bit of an NPR thought here, and this one's from today, 3-minute listen.
You may have heard a lot of advertising about Medicare Advantage plans.
2024 Medicare Advantage plans are now available, so everyone on Medicare can call to see if a Medicare Advantage
These Medicare Advantage plans are private insurance that Americans 65 and older can opt for instead of traditional Medicare. Lots of Americans are signing up. It is an open enrollment period from now through March. But as Sarah Jane Tribble with our partner KFF Health News reports, some people regret enrolling in the program and then have trouble getting out.
Back in 2016, when Richard Timmons first signed up for Medicare, he went to a free informational seminar with an insurance agent.
Basically, he really promoted Medicare Advantage. He just said, well, look, it's less expensive. It's broader in coverage.
For Timmons, it made economic sense to sign up for Medicare Advantage instead of traditional Medicare. And that worked out great for a while. Then he found a small bump on the back of his right ear.
I have a family history of melanoma, so I was kind of tuned into that and thinking about that.
But it took him a long time to see the right specialist in his Medicare Advantage network, and getting the paperwork in order was confusing.
It started to grow and started to become rather painful.
By the time Timmons finally saw an oncologist, the lesion had grown to the size of a dime. His right earlobe needed to be removed. He thinks getting care using traditional Medicare would have been faster and easier. And David Myers at Brown University School of Public Health says he's probably right.
You can see any provider you want. There are many less sort of restrictions on care. You get a lot more freedom with traditional Medicare.
Timmons wishes he could switch, but there's a catch.
Would I go back to traditional Medicare if it was not cost prohibitive? Absolutely.
Traditional Medicare premiums average about $170 a month. And while enrollees on Medicare Advantage plans still pay that premium, the monthly cost can be more affordable. That's because plan enrollees often don't have to pay for extra prescription coverage. They also don't have to buy supplemental insurance, usually called Medigap. That supplemental insurance is needed because, unlike Medicare Advantage plans, traditional Medicare doesn't cap out-of-pocket cost. The thing is,
conditions unless you enroll during certain designated times.
that designated time is primarily when you first sign up for Medicare. But since Timmons enrolled in a Medicare Advantage plan instead of traditional Medicare, and he has a pre-existing condition, he could be denied Medigap or charged a lot more for it. While federal law generally prohibits insurers from denying people coverage because of pre-existing conditions, Medigap is an exception. Lipschutz again.
It's a lot easier to get and stay in a Medicare Advantage plan, but a lot harder to get out and pick up a Medigap plan, depending upon where you are.
Only 4 states require Medigap insurers to cover applicants, regardless of age or health. But Timmons lives in Washington state, which isn't one of them. He wants people to know.
You can get screwed if you're on Medicare Advantage. The advantage kind of disappears once you need them.
In the meantime, Timmons worries. There's a chance that his cancer could come back, and he'll be trapped on Medicare Advantage if it does. So he's focusing on what he can control.
I'm I'm vegetarian. I don't drink. I don't smoke. I try to get exercise as much as possible.
But he knows it might not be enough.
That was Sarah Jane Tribble with our partner, KFF Health News.
So, right, guys, I mean, interesting little
And
NPR
now,
take
more
there.
from NPR.
Just listening to that.
Live from NPR News.
2 seconds. All right. Cutting that off. So interesting little NPR take, getting at all Medicare Advantage plans being, in a lot of cases to some descriptive people, the devil, right? The customization of those services and the plans really, really changes and becomes specific for each and every single adult. Who do I recommend? Obviously, in those times, might have a little bit of a late sign-up situation coming right now. But if you are looking at those situations for the new year, here in New Mexico, here in Las Cruces, Distinguished Choice Insurance Solutions, these guys are very, very helpful in trying to help you navigate exactly what the heck is going on when it comes to Medicare, Medicare Advantage, and exactly how this works, right? Because as you say, or as we know, our most vulnerable there are seniors who put in their entire lives working to feed that system that's supposed to take care of them healthcare wise, but really gets kind of manipulated and taken advantage of. And that's just horrible. So what can we do is try to stay on top of that. New year, a lot of people might be looking at books and the year ends and stuff like that, tax time, good time to start really thinking about your healthcare options. But again, you're not going to know by yourself. You got to talk to somebody. That's why I recommend, Distinguished Choice Insurance Solutions. These guys are very good there. So check it out. Enlightenment Hour, guys. This one's a cool one. Scientists destroy 99% of cancer cells in the lab using vibrating molecules. How, right? Scientists have discovered a new way to destroy cancer cells, stimulating aminocyanide molecules with near-infrared light causes them to vibrate and sync enough to break apart the membranes of cancer cells. So aminocyanide molecules are already used in bioimaging as synthetic dyes. Commonly used in low doses to detect cancer, they stay stable in water and are good at attaching themselves to outside of cells. See below, right? So as you see this disruption right here with the NIR light, well, a research team from Rice University, Texas A&M University, University of Texas, say the new approach is a marked improvement over another kind of cancer-killing molecular machine previously developed called pharyngotype motors, which could also break the structures of the problematic cells. See your picture, right? Whole new generation of molecular machines that we call molecular jackhammers. Bada boom, bada bing, right? Vibration nation. Murder cancer, right? That's what we want to see. Over 1 million times faster in their mechanical motion than the former pharyngotype motors, and they can be activated with near-infrared light rather than visible light. The use of near-infrared light is important because it enables scientists to get deeper into the body. Cancer in bones and organs could potentially be treated without needing surgery to get to the cancer growth. In tests on cultured lab-grown cancer cells, the molecular jackhammer method scored a 99% hit rate at destroying the cells. The approach was also tested on mice with the melanoma tumors, and half the animals became cancer-free. So, right? Interesting. Structure and chemical properties of aminocyanide molecules mean they stay in sync with the right stimulus, such as near-infrared light. When in motion, the electrons inside the molecules form what's known as called plasmons, collectively vibrating entities that drive movement across the whole molecule. What needs to be highlighted is that we've discovered another explanation for how these molecules can work, right? The first time is a molecular plasmon is utilized in this way to excite the whole molecule and actually produce mechanical action used to achieve a particular goal, in this case, tearing apart the cell membrane, right? Cancer cell. Anyways, very exciting to see what comes out of technology and cancer treatment in 2024, for sure. Guys, another interesting study was shared with you in our Herbal Wellness Corner, brought to you by High Horse Cannabis Company. Shop High Horse Cannabis Company for all the great New Year's discounts currently, available. Cannabis for menopause. Canadian survey finds women use cannabis for symptom relief. Well, what's that looking like? Canadian studies suggest that women are using cannabis for symptoms related to menopause. The study published in BMJ Open found that current cannabis users were more likely to report having menopausal symptoms than non-users. The objective of the current study was to characterize the use patterns and perceptions of cannabis, specifically for menopause in a population of women aged 35 and over. We need to engage with women to understand if and how cannabis is being used for menopause symptoms and what forms women are preferring to use, so the authors wrote, right? Well, the research team conducted a cross-sectional web-based survey of 1,485 adult women living in Alberta, Canada between October and December of 2020. 50-item questionnaire included data on demographics, menopausal symptoms, and cannabis use. Survey sample had a median age of 49 users, with 35% reporting being postmenopausal and 33% perimenopausal. Out of 1,485 participants, 499 or 34% of the women reported currently using cannabis, while 978, 66% reported ever using it. More than 75% of respondents were using medical cannabis for medical reasons such as sleep, anxiety, and muscle pain. A total of 74% of women reported that cannabis was helpful in relieving menopause symptoms, and those who currently use cannabis were more likely to report having symptoms of menopause than those who did not. Some 51% of women reported using edible cannabis, 47% used oils, and approximately 41% smoked it. Almost 64% of the respondents obtained their cannabis from in-person dispensaries. Well, vulnerabilities of the study. Authors caution that self-reported data are often subject to several types of bias. Self-selected nature of the respondents also limits the ability to generalize the results, right? confounding factors. But something that should be explored more often than not, especially when we're looking at menopause as such a uncomfortable and transitional time in a period of we call life. I'm a guy, I guess I will never understand it fully, completely. I submit to that already, but women helping women, I encourage that conversation there, and I will show you, data that can definitely help in those situations. All right, guys, community spotlight highlighting Kyle Larson coming down to freaking Vado Speedway Park. If you guys don't know who Kyle Larson is, literally, already debated as the greatest race car driver of all time. He can race just about anything. And guys, he's coming down to Vado Speedway Park for the Wild West Shootout event running January 6th, 7th, 10th, 12th through 14th at Vado. Racing starting at 5 or 6, depending on the night. Event schedule, VadoSpeedwayPark.com. Guys, we got the whole thing right here. You can buy tickets, for the Wild West Shootout, 6-day reserved seat package, $155. Pick nights, right? $30. $35 for Sunday show. Big money on the line. There's gonna be, oh my gosh, salivating amounts of racing. Insane, guys. So how about that? Last thing, guys, Men's Health Minute, and let's get out of here. Call it a good evening. Men's heart and vascular health. What are we talking about today, guys? Making sure we know stats on heart health, why we should be getting checked, why we should be managing the things that lead to poor outcomes in heart health. Well, heart disease causes about 1 in 4 deaths, male deaths in the U.S. every year. Most men will experience their first heart attack around the age of 65. About 80% of all cases of heart failure occur in men. Good news is that with a few lifestyle changes and the right medical supervision, you can improve your heart health sooner than you think, guys. Preventative care and education and awareness, man, is so important in actually getting to the doctors, men, in our Men's Health Minute. So that's what we're talking about. Just slap down some quick facts. I'm not going to lecture. I'm just going to make sure that, important messages are said. And otherwise, hope everybody has a wonderful